were done, Maine would be facing a shortage of 3,200 registered nurses, 3,200 nurses by 2025. And that shortage was driven by retiring healthcare workers and by a rising demand for healthcare among Maine's aging population. When I took office, I discovered that despite this problem and others in industries statewide, there was no coordinated statewide strategy to fix it. So I put Heather Johnson, our Commissioner of PCD, Economic Community Development, to work. She traveled across the state of Maine, met with 1,300 leaders in every corner of the state and every sector, and came up with our 10-year economic development strategy. She came up with a great plan to grow our economy, and that had widespread support across the state. But then, 3 months later, as you know, a once-in-a-generation global pandemic hit the state and hit the country, shaking the foundations of our state and our country, deepening the cracks in our economy that had existed long before. So we got to work on protecting the lives of Maine people and the livelihoods of Maine people. We put together an economic recovery committee in the middle of this pandemic. And that committee, 40 wonderful people, brought back recommendations to stabilize our economy and build it back better. The Biden administration and the Congress delivered the American Rescue Plan, and with those significant financial resources, we used the recommendations from the 10-year plan and our Economic Recovery Committee to create the Maine Jobs and Recovery Plan. This plan focuses on 3 goals. This plan focuses on 3 goals. 1, immediate economic recovery from the pandemic. 2, long-term economic growth for Maine. And 3, infrastructure revitalization. We took that plan to the legislature, and with a few minor changes, they passed it. It is now law. And last week, I announced a $139 million plan to invest money in the small business grant program, lowering monthly health insurance premiums for employed people, and replenishing the Maine Unemployment Trust Fund and mitigating tax hikes for small businesses. Today, I'm announcing the next investments in Maine's Job and Recovery Plan. These are new initiatives to strengthen Maine's healthcare workforce in the face of the COVID-19 pandemic. The healthcare sector is one of Maine's largest employers, and it provides thousands of fulfilling and good-paying jobs that save lives and protect the health and welfare of individuals in our state. For a long time now, healthcare facilities across the state have had to grapple with a shortage of workers that this pandemic has only made worse. And it's pushed our healthcare system in ways that we never could have imagined. Now, the burden of yet another surge of the virus, the Delta virus, primarily among the unvaccinated, puts pressure on our healthcare workers and our healthcare system more than ever before. So to bolster our current healthcare workforce in the short term and to recruit and retain new healthcare workers in the long term, I'm announcing 4 initiatives, all funded by more than $14 million from the Maine Jobs and Recovery Plan. That's federal money specifically for this kind of thing to help states recover from the pandemic. To make it more affordable for Maine people to pursue healthcare jobs, we plan to invest $4 million in scholarships and student loan relief for people pursuing careers in nursing, doctors, in medical doctors, or as behavioral health professionals. Too often, going to school to become a nurse or a doctor or other professional is just too expensive. And that means that our healthcare sector loses out when smart, hardworking people take other paths. If you want to be a doctor or a nurse or behavioral health professional, work that is so important to society as a whole, cost should not be a barrier. These programs will help accomplish that. To encourage existing healthcare workers to move up the career ladder, we'll also invest $8.5 million to make training for new skills and new credentials cost-free. Right now, employees might get tuition reimbursement from their employer, but that requires paying for it up front. out of their own pockets. By knocking down that cost barrier and investing in the long-term success of our healthcare workers, we'll improve retention rates and increase the average wage of healthcare workers, improving outcomes for healthcare employers and their systems overall. In the short term, to promote healthcare jobs and attract new talent to the field, we'll also invest $1.5 million in federal funds for a recruitment campaign, including social media, radio, etc. And this will promote healthcare as the meaningful, rewarding career that it is, one that provides great opportunities for advancement, for security, for good pay and benefits, especially for younger Mainers. We'll also invest $600,000 in healthcare career navigators who will be housed in the Maine Department of Labor's career centers to provide customized guidance to those with some relevant training or experience who come from other jurisdictions. These navigators will create person-specific employment and training plans. They'll navigate available training opportunities and assist with evaluation and translation of prior credentials when needed. And they'll refer people for healthcare job and apprenticeship opportunities. With these initiatives, we want to make it easier and more affordable for people, especially young people, to pursue careers in healthcare, move up the career ladder into higher paying jobs, understanding that these jobs provide a rewarding opportunity to do life-saving work and make a good wage with benefits at the same time. So this more than $14 million investment in our healthcare workforce through programs that will be in place by the end of the year builds on our previous financial support for Maine's healthcare sector during the pandemic. For instance, in 2020, we distributed nearly $60 million in one-time temporary payment increases to a broad range of healthcare providers. Earlier this year, we distributed $40 million in one-time payments to behavioral health providers, hospitals, and nursing homes. Last week, we issued $23 million in one-time supplemental payments to Maine's hospitals that were authorized in the biannual budget. And we authorized $35 million out of the American Rescue Plan funds to go to the Maine Community College system for workforce training, including training 3,800 healthcare workers. And this week, we'll make the second installment of $123 million in Medicaid supplemental payments authorized in the biannual budget. Our healthcare workforce is not the only sector facing serious challenges in our state. These investments are just the beginning. In the coming weeks, we'll continue to announce more Maine Jobs and Recovery Plan investments to expand our workforce and to strengthen our economy. I want to thank Chuck Hayes for allowing us to hold this exciting announcement here today, and Angela Westhoff and Darcy Shargo for joining us as well. I'm grateful for Maine General's partnership as one of our leading healthcare providers throughout the pandemic. The staff here at Maine General, in our nursing homes, in our community health centers, and in healthcare facilities across Maine have been the very backbone of our response to COVID-19. They've shown up on the front lines for well over a year now, a year and a half, working tirelessly to save the lives of Maine people, all the while enduring risk to their own health and the added pressure and stress of the job. Their work is meaningful beyond words, and it's crucial to the health of our people. On behalf of Maine people, I want to thank all of them for these efforts and for the vital work I know they continue to do as we work together to turn the tide in this pandemic. Mr. Hayes, would you like to say a few words?
Thank you, Gemma. Well, first, let me welcome everybody to Maine General's Alphons Center for Health. I wanted to take the opportunity to thank Governor Mills and our healthcare partners for being here today. We've all worked closely together, especially during the pandemic, to ensure access to the highest quality health care across the state of Maine. The support of these partners has been an enormous help as we navigate these uncharted waters. We especially appreciate the level of communication and cooperation from Governor Mills and her staff, Commissioner Lambrew, Dr. Shah, and many others across the state government working day in and day out to address the pandemic. The investment the governor is detailing today are so important to us and other healthcare organizations across the state. It's been a long 19 months. Here at Maine General, our 4,500 dedicated workers have been answering the call, focused on providing the best care and service to every patient every time. Our staff has committed themselves to helping others, being on the front lines to support the patients, residents, and our community. They've continued to adapt to the protocols necessary to keep everyone safe. And they've done all this with caring and compassion that is needed now more than ever in our community. I can't say enough how inspiring these healthcare heroes are. But like other hospitals in the state, our staff is stretched thin. It's been all hands on deck for 19 months. We are in need of more hands. That's why the resources that the governor is talking about today are so important. Reducing the financial barriers to healthcare education is critical. We at Maine General currently offer a CNA program, Earn to Learn, that allows staff to get paid as they learn to become a CNA. Having additional financial support to offer more of these classes would be extremely helpful. Having staff continue their healthcare education and be promoted from within is a win-win for all. The governor's plan will help attract new workers to the healthcare field, support those already interested in a career in healthcare, and keep those working in the field now to advance their careers. This support for our workforce comes in addition to the financial support for our day-to-day operations during the pandemic through temporary rate increases and funding in the governor's biennial budget. All of this will help us continue to provide great care and service here at Maine General. Thank you, Governor Mills, for today and for your tireless efforts in helping Maine hospitals. Thank you.
Thank you, President Hayes. And I also want to invite to the podium Angela Westoff from the Maine Health Association.
Thank you very much, Governor. Good afternoon. My name is Angela Westoff, and I'm the President and CEO of the Maine Healthcare Association. I'm pleased to provide some comments today on the Maine Jobs and Recovery Plan initiatives to strengthen Maine's healthcare workforce. The Maine Healthcare Association is a nonprofit trade association representing 200 nursing homes and assisted living and residential care facilities throughout Maine. Our members provide a range of long-term care services that include nursing, skilled nursing, rehabilitation, assisted living, residential care, and adult daycare services. The COVID-19 pandemic has put tremendous strain on Maine's nursing home and assisted living communities as the workforce crisis continues to worsen. Our employees have remained committed to their residents throughout this extraordinary time. But today, nearly 18 months since the beginning of the public health emergency, we're seeing the toll on our workforce. Our members are very concerned about staffing shortages as more caregivers exit the profession due to burnout and stress and fewer people enter it. The time to act on this disturbing trend is now. MHCA is pleased to partner with the administration on tangible solutions that will encourage, incentivize, and cultivate the next generation of Maine's healthcare professionals. A well-trained, plentiful workforce is critical to maintaining access to quality long-term care services in Maine. Part of the governor's plan will focus on attracting and retaining workers through targeted marketing campaigns that will promote the value of working in healthcare and encourage young people to enter careers in these fields. In addition, the plan will create programs that assist direct care workers to determine the best career path, learn new skills, earn advanced credentials, and move up the career ladder faster. Finally, providing scholarships and student loan relief to students will help reduce financial burdens of those pursuing healthcare careers. These are important first steps in addressing Maine's healthcare workforce shortage. As the pandemic continues, it is critically important that we work collaboratively to address these challenges and implement short and long-term strategies to recruit and retain our caregivers. As employers, Maine's long-term care facilities stand ready to assist in these endeavors. Thank you very much.
Thank you, President Westhoff. And I want to introduce one more speaker, Darcy Shargo, President of the Maine Primary Care Association. Darcy.
Thank you, Governor. Good afternoon. I'm Darcy Shargo. I'm the CEO of the Maine Primary Care Association. The association represents Maine's 20 federally qualified health centers that collectively serve 1 in 6 Maine people and constitute the largest and most comprehensive network of primary care in our state. I'm excited to be here today in partnership with the Governor, thank you very much, and with DHHS and DOL respectively. With the investments outlined today, Maine is positioning itself as a solutions-focused leader in workforce issues. The projects noted show a significant commitment to addressing what has been a long-standing challenge for Maine's FQHCs and the healthcare sector overall: the ability to attract and retain a strong, mission-oriented, and capable workforce. Now, more than ever, we need state leaders to walk alongside us to build our healthcare workforce so that we can weather the inevitable afterstorms that we know the pandemic will create. Maine's health centers have felt a very deep impact from COVID-19 as they've continued to lead and support local and regional rapid response while providing everyday care. To keep pace and to make sure there is access to primary care in our future, we celebrate these investments as ways to reinvigorate the pipelines to primary care settings, build incentive programs, training opportunities, and career ladders, to augment the existing work that the association has been doing around marketing and getting young people excited about health careers. And finally, and I think probably the most important, this investment gives healthcare providers a much needed boost of hope. And by that I mean that hopefully when we get through this recovery or to a point of recovery, our providers will see that Maine is working for them to develop a bench strength in the healthcare sector so that there's a future for us and for them. Thank you very much.
Thank you, Darcy. Excuse me. Also present with us today are Commissioner Laura Fortman of the Maine Department of Labor and Commissioner Jean Lambrew of the Maine Department of Health and Human Services. And I think we could entertain a few questions, if you wish.
Governor, do you have any estimate how many people this might help, aspiring healthcare professionals, or the number of jobs that might result as a result of these programs?
In the thousands. Well, do you have a specific number? Or, there is not a specific numerical goal for each of these categories, but for instance, getting people into apprenticeships is real important, and however many want to take them, we'll fill them up. And get people working and getting them in that career path. In terms of the doctors and nurses and behavioral health specialists and the tuition reimbursement and the loan reimbursement programs, there was not a specific number attached to that either. I think there was some testimony in the legislature about some estimates, but clearly hundreds.
Governor, you have a deadline coming up this week for the vaccination mandate. Is there anything in here that would help address some of the concerns about worker losses because of the mandate?
Everything we're doing is to encourage people to get vaccinated and to get into healthcare professions. As the First Circuit noted last week and the Federal District Court earlier that week, we have done so much to make people safe, starting with testing in healthcare facilities, daily testing, biweekly testing, PPE, which is required in many instances, but also a stressful thing too, and financial incentives and whatnot. So as the Federal Court and the Federal Court of Appeals concluded last week, the vaccination job requirement is something that its time has come, and it will help keep not only workers safe, but patients safe in all of these various settings. And once everyone is vaccinated, once vaccination has been achieved to the fullest extent possible, we're going to get beyond this pandemic. It's the virus. It's the virus, not the vaccine, that's the problem here.
Yep.
Commissioner Lambrew?
Sure. Turn it over here.
Sure.
And I would just add that we really do see that as we've heard from our healthcare professionals, the healthcare workforce shortage is not new to the state of Maine. The pandemic has exacerbated it, from causing, as of Friday, 6,762 healthcare workers to be COVID positive, not counting another hundreds, if not thousands, who have been unvaccinated and had to go into quarantine and taken off their jobs. Our solution, our way out of this is the vaccination. We are, in the meantime, working with all of our facilities on how do we fill in those short-term gaps with flexibilities, with different training programs in the short run. Whatever we can do in that transition, we're here to do. But we just have to remember that this is a problem of healthcare workforce that predated the pandemic, and it really is the toll of the pandemic, including on burnout, that really is what's driving the workforce shortage today.
Would any of this money be specifically used for that purpose to fill in the short-term gaps?
So this money in the Maine Jobs and Recovery Plan, we developed back in the spring to look forward to exactly that, the recovery. So all of this money is going to, in the winter and spring, hopefully be bringing people into these careers. But as the governor mentioned, we moved out $60 million last year in temporary rate increases to support these short-term recruitment and retention efforts. Another $40 million last summer, another $143 million this fall. All of those dollars can, and we're hoping are being used for those short-term efforts to try to get people to come in on signing bonuses, to try to get those workers who may be thinking about different jobs to stay in healthcare. So recruitment and retention are two areas that we've been encouraging our partners in the healthcare field to use these dollars for.
Commissioner Fortman, there's something to add.
The only thing that I would add to that, Kevin, is that right now anyone can go talk to someone at the Career Center. There are other sources of funding that have been there all along. As both Commissioner Lambrew and the governor have said, healthcare careers have been a priority prior to the pandemic and continue to be a priority now. So there are avenues, paths, and resources available to help people in those careers, and we encourage people to take advantage of those.
Governor Mills, this is kind of a two-part question, but is there a specific type of healthcare worker that we don't have enough of that's a little bit worse than some of the others? And is this funding going to focus on those groups that were more lacking, or is it more broad?
It's available for all tiers, all levels of healthcare and healthcare workforce. I think we're seeing a shortage of nurses in particular. That's sort of been highlighted by the healthcare facilities we've been talking to. And we have weekly, if not more often, more frequent, conferences with all the healthcare facilities, nursing homes, hospitals, others, and try to assess where they're at, what their challenges are.
So I do want to add, though, what we've learned is that, as Chuck described with his CNA and training program, one of the best ways to get workers to come into this field and stay is to get them at the entry level. So one of the things we'll be doing this winter is how do we brand healthcare jobs for our young people here in Maine who are here thinking about what do they do after high school or college. How do we talk to them about healthcare jobs, get them in the door, and then offer them an opportunity to earn and learn, to be in jobs, to have those sorts of training programs that also build on each other, like building blocks, because too often you go to the end of one degree, you have to go back and start again to get the next degree. So what we're going to try to do is use these dollars to create those career pathways that allow people to be employed, to fill these critical jobs while they're learning and getting into these high paid and high quality jobs.
I have a question for, I guess, towards Chuck and Darcy. I would have asked Angela, but it looks like she's stepped out, so I'll have to email her. You guys know your industries better than anybody else. What of this plan do you see as having the most immediate impact on the workforce challenges that you're seeing?
Chuck and Darcy?
I think certainly the focus on getting young people in and interested in careers has potential to have a really significant impact. Because what we're also talking about is building career ladders. So someone in the case of primary care might come in, start as a PSR, patient service go to MA and then maybe go to nursing school and become a provider or even advanced practice nurse. For example, I think that has a lot of potential, just sort of highlighting the needs of the career and the fact that we can build a healthcare system and healthcare jobs that are going to help us really be able to confront what's next. We're eventually going to get through this pandemic, and we need a workforce that's trained and available to handle that once we're there.
And I would agree with that, and I think it's really helpful. As the governor said, here in Maine General, you want to go to a class and get reimbursed, reimbursement, but it is upfront. You get to take the class and pass the class, and then you get reimbursed. This, for people who are having a hard time financially, they may not be able to afford it. This is hugely for that, and it benefits us as well because we're growing our own internally, and then certainly some of the other pieces are going to help just add more people to the ranks. Certainly something that we need here. She quoted some of the shortages we had prior to the pandemic. So we saw this coming, we started working on it, but it needs more. I think this is a welcome addition.
It sounds like some of these things are definitely kind of like built towards recruiting and retention, and Commissioner Lambert mentioned somebody that has hopefully been using the short term to try to address some of the workforce shortages right now. I'm wondering what you think of how those are going. Do you think those programs are helping?
What's going, I'm sorry, which,
Okay, do you want to come to the microphone
you mean,
so they can hear you? I think it's a question over Chuck.
oh, okay, sorry.
Yeah. Oh, no, that's okay. So Commissioner Lambert mentioned some money that's being used kind of hopefully in the short term to address some of the workforce challenges that the industries are facing. And I'm just curious about, are you feeling like that's helping? Are you seeing some effects from that?
Oh, I definitely think it is. I mean, a lot of what we did, so for example, we took our CNA classes, we doubled the size. Which is huge for us, for the certified nursing assistants are critical. And as they talked about the nurse shortage, the government talked about the nurse shortage, there's a CNA shortage as well. So certainly investing in those, educating people, and as I said, we pay them to go through the school, so that helps them be able to cover their bills while they're getting educated. And a lot of times, and this program will help, that CNA will then go on to nursing. So I think it's all extremely helpful in really building our numbers up, but also educating our folks for the next step in their clinical ladder.
All right, we have time for one more last question. I have a quick question for a coworker working on another story, but she's working on a story about the statewide bus driver shortage. She's working on a story about the statewide bus driver shortage, and I know the Massachusetts National Guard has brought in a handful of drivers to try to assist with this. I know we've asked you this before, but any reconsideration, is that going to happen here, or are there other things that the state is doing to help with this problem?
with bus drivers, I can get back to you on that. I can't tell you today that we're doing something specific to help with bus drivers. I know that the goal right now is to get bus drivers, janitors, school staff, and everyone vaccinated, particularly this week, get them fully vaccinated. They haven't been already, and protect our kids and make sure our kids are back to school. You were talking about school buses, right?
Yes, yeah, sorry.
Leaf keepers, tour buses. Let me just add, we talk about workforce shortage. 13, 14 years ago, I was on the Appropriations Committee, state representative for Farmington, Maine. We spent literally hundreds of hours at that time talking about healthcare workforce shortages. We pumped a lot of assets or investments into the University of Maine at Fort Kent to beef up a big nursing program there, which is still very viable and very popular. We talked about where we could pump money into various programs across the state. That was a long time ago, and we're still talking about that. And now I think we're taking a really holistic approach at this with the help and huge benefit of the American Rescue Plan money from President Biden and the Congress of the United States. This is a huge advantage, something we never had before. So I'm delighted to have these funds to match the challenges and shortages that we have right now and get beyond this problem that we've been facing for decades. Thank you.